Social distancing mistakes that put you at risk for coronavirus. Social distancing experts say it's the key to slowing the spread of coronavirus, COVID-19, and preventing medical resources from being overwhelmed. You may know the basics: stay 6 feet apart from others and wear a cloth face covering in public, but like so many of us with much on our minds these days, mistakes sometimes become inevitable and can render your best efforts ineffective. Here are some common social distancing mistakes that increase your risk of contracting coronavirus and ultimately infecting those individuals whom you may come in contact with. Number 1. You're arranging playdates. Some parents let their children go out and play with others because it was once believed that only the elderly are at risk, or were at risk. In reality, children have the same risk of getting infected. Kawasaki disease, an acute illness of unknown cause, occurring primarily in children, characterized by high fever, swollen lymph glands, rash, redness in mouth and throat, and joint pain. However, they are much more often asymptomatic. They can still spread the infection, which puts everyone else at risk, and especially their parents or grandparents if they live together or get in close contact. Number 2. You think you're invincible. You're not, and it's in your best interest to wake up to our new reality, before it's too late. Coronavirus is so dangerous because no one is immune. Young people think that social distancing is just for the elderly, and they can't have severe symptoms. In reality, around 40% of the patients that required hospitalization were between 18 and 54 years old, according to the CDC, and many other sources. Perfect example: Kawasaki disease believed to be caused by coronavirus and or COVID-19 in children. Number 3. You're going to parks. Stop congregating. Congregating, while it may not seem obvious, social distancing includes avoiding areas in which others have recently touched or been. People should avoid playgrounds, movie theater, clubs or bars, nail and hair salons, or anywhere where large crowds or gatherings have taken place and has not been properly sterilized, because the virus may live on inanimate objects or surfaces for days. Number 4. You exercise in close proximity. Although it's still important to get some exercise, you should do it a safe distance away from others. People should not walk or exercise behind other people. The wind may blow the virus backward, and you can become exposed that way, despite being more than 10 feet behind someone else. You should always take extra precaution while outside around other people or in close proximity. Number 5. You don't use a mask correctly. The CDC, World Health Organization, and the Center for Infectious Disease continues to recommend that the general public should cover their faces with a cloth mask when outside or around others. But wearing it correctly is key. Some people don't wear a mask and, when they do, they don't take it off or wear it correctly. It's a mistake to take off their mask from the front and then touch the contaminated area. To remove a mask safely, wash your hands with soap and hot water for 20 seconds, remove the mask from loops, and put it in a safe place and then wash your hands again. Be diligent in your hygiene efforts, a condition or practice conducive to the preservation of health and cleanliness. Number 6. You're not staying apart. Don't put yourself at risk. It all comes down to following the guidelines, 6 feet apart from another individual. An example is that you shouldn't be sitting next to each other while eating lunch at work. The reason is that droplets that contain the virus can still land on your clothing, phone, or other personal items if you come too close to an infected person or while speaking to each other. Number 7. You make repeat shopping trips. Minimize outside trips. The more times you go out in public, the more chances you have to catch the virus. People don't make a list, so they have to go back to the store too often. Limit your shopping trips by planning ahead, and stock up as much as possible in one place. Number 8. You don't cover your eyes. People really should wear eye protection as well. It's not required, although someone can contract the virus that way, but the transmission rate is very low that way. However, if you are heading into a grocery store, you should wear some glasses to remind yourself not to rub your eyes. Number 9. You're still using gloves wrong. What you should know. Remember that protective gloves can be germ magnets, just like your bare hands. Gloves do not resist the virus. And when your gloves have touched store shelves, shipped boxes, and your car, then your face or your food, you just potentially contaminated yourself with your gloves. If you wear gloves on an errand run, take them off before getting in your car or returning home. Most of all, do not touch your face or anything you will eat or drink while you have gloves on. You should still wash your hands after disposing of those gloves. Number 10. You're inviting people over. Even if you don't go outside to public gatherings, inviting people over to your home also invites the people they've been in contact with. Viruses need to move from person to stay alive. Social distancing makes it difficult for viruses to move, thus the saying, if you don't move, then neither can the virus. We don't completely understand this virus, no one does. While we know the 10 outlined statements above to be facts, we still don't have all the facts. New information is emerging every day, and as new development arise, we'll keep our viewers fully informed. In the meantime, be smart, be safe and stay healthy. Stay home, stay strong and save lives. We will get through this together, because we are all in this together. Continue practicing social distancing and cover your nose and mouth to stop the spread of coronavirus, COVID-19.